Birth control pills are one of the most commonly used methods of preventing pregnancy. When taken correctly, they are highly effective, over 99% in ideal use. However, many people don't realize that certain medications and substances can reduce their effectiveness, increasing the risk of unintended pregnancy. Understanding these interactions is crucial for anyone relying on oral contraceptives. In this video, we'll explore 10 common drugs that can interfere with birth control pills and explain how these interactions occur. 1. Rifampin and other rifamycin antibiotics. Rifampin is a powerful antibiotic used to treat tuberculosis and some bacterial infections. It is one of the most well-documented drugs to reduce the effectiveness of birth control pills. Rifampin speeds up the liver enzymes that break down estrogen and progestin, the active hormones in birth control. As a result, these hormones are cleared from the body more quickly, lowering their levels and reducing contraceptive protection. While most antibiotics don't affect the pill, rifampin and similar drugs are a clear exception. 2. Certain anticonvulsants, seizure medications. Medications like phenytoin, carbamazepine, phenobarbital, and topiramate are commonly prescribed to control seizures. These drugs also induce liver enzymes, which can speed up hormone metabolism. This can cause birth control pills to be less effective. Women who are on long-term anticonvulsants and need birth control are often advised to consider non-hormonal methods or higher-dose hormonal options under a doctor's supervision. 3. Griseofulvin, antifungal medication. Griseofulvin is an older antifungal used for treating fungal infections of the skin, hair, and nails. It can also interfere with hormonal contraceptives in a similar way to rifampin. Although it's not commonly used anymore, it's important to be cautious if it's prescribed. Many modern antifungals like fluconazole and ketoconazole do not have the same interaction, but always confirm with your doctor. 4. Certain HIV medications. Some antiretroviral therapies, ARVs, used to treat HIV can reduce the effectiveness of hormonal birth control. Drugs like ritonavir, lopinavir, and nevirapine are known to induce liver enzymes and alter hormone levels. On the other hand, some newer HIV drugs have minimal or no effect. It's critical for HIV-positive women to work closely with their healthcare provider to find a compatible contraceptive method. 5. Modafinil, used for narcolepsy or ADHD. Modafinil is prescribed to promote wakefulness in people with narcolepsy, sleep apnea, or even sometimes for off-label uses like ADHD. Studies show that modafinil significantly reduces the effectiveness of birth control pills, patches, and rings. Doctors typically recommend switching to a non-hormonal birth control method while using this medication. 6. St. John's Wort, herbal supplement. St. John's Wort is a popular over-the-counter herbal remedy used to treat mild depression and mood disorders. However, many people don't realize it can seriously interfere with hormonal birth control. It increases the activity of liver enzymes that break down estrogen and progestin, making birth control less effective. Always tell your healthcare provider if you're using herbal or natural supplements. 7. Barbiturates. Barbiturates, such as secobarbital and amobarbital, are sedatives that depress the central nervous system. Though not widely used today, they still appear in some treatments for anxiety, insomnia, or epilepsy. Like anticonvulsants, they induce liver enzymes and decrease hormone levels in the bloodstream, posing a risk of contraceptive failure. 8. Bosentan, pulmonary hypertension drug. Bosentan is a drug used to treat pulmonary arterial hypertension. It interacts with birth control by lowering hormone levels in the blood. Moreover, birth control pills may also reduce bosentan's effectiveness. In such cases, doctors usually recommend double contraception, using both hormonal and barrier methods like condoms. 9. Some anti-cancer drugs, chemotherapy agents. Certain chemotherapy medications, especially those that affect liver enzymes or hormone pathways, may interfere with the effectiveness of hormonal birth control. For example, drugs like cyclophosphamide can have unpredictable effects. Moreover, chemotherapy itself can affect fertility, so a comprehensive reproductive health plan is necessary during treatment. 10. Certain anti-anxiety or mental health drugs, limited cases. Some mood stabilizers and psychiatric medications have shown potential interaction with birth control in isolated cases. For instance, lamotrigine, used for bipolar disorder and seizures, may not reduce pill effectiveness but can have altered effects when used alongside estrogen-containing pills. Estrogen can reduce lamotrigine levels, possibly triggering mood instability.